Okay, Christina. Now we're going to be doing an abdominal assessment. And have you noticed any change in your appetite?
No,
Have you had any abdominal pain?
no,
Any nausea, vomiting, any change in your bowel habits?
no,
Okay, good. And do you take any medicines for your belly?
no.
Okay. So first thing I would do is I would look at her abdominal area, just looking at the skin. And I'm not going to pull up her shirt, but I would see that her skin is clear. There's no rashes or anything on it, no abnormal coloring or anything. Her skin would be the same even tone as the rest of her body. Um, her her abdominal area is flat. Uh, she doesn't have any bulges or any masses that I can see right now. Okay, first thing I want to ask you to do, Christina, is take a deep breath and hold it. Okay, now just looking again, I don't see any masses or anything. Okay, release. Okay, now just kind of raise your head up like you're going to do a crunch. I'm going to look at your belly. Okay, again, no masses. Okay, you can lay your head back, sweetie. Looking at her belly button, I see that her belly button is in midline um, with the sternal area. I don't see any swelling, any masses here or anything. Her umbilical area is inverted. Let's see. Had you hold your breath? Now I'm going to listen to your bowel sounds. It won't hurt. I'm going to listen to all four quadrants. Okay, bowel sounds are active in all four quadrants. I don't hear any friction rubs. Well, let me listen. Let me listen all over. I'm going to be listening to the aortic area, her abdominal aortic area. Okay, her renal arteries. The iliac arteries. Just at the crest of the iliacs, her iliacs. Okay, and her femoral arteries. Okay, now I'm going to be now I'm going to be touching you a little bit. I'm going to be mashing on your belly. I'm going to be trying to feel for some organs. I'm going to start soft, then I'm going to get a little bit harder, a little bit deeper, and then I'm going to go again, deeper again. Okay. Christina's ticklish, so her abdominal area is a little rigid. But I'm not feeling any masses at this point. Okay, now I'm going to go a little bit deeper. That shouldn't be ticklish because I'm pushing hard. Okay. And now we're going to go deeper again. Okay, this is going to be a little bit farther than what we did the last time. 5 to 8 centimeters. Okay. I can feel her intercostal area. There's both sides of it are smooth. She doesn't have any tenderness, obviously, since she's laughing. Trying to palpate the liver here in the right upper quadrant. It's difficult to feel on her. And again, the gallbladder, it's just below the liver and above the abdominal muscles. This is with deep palpation. Okay. So the spleen We want a feel on the left side, so I'm going to put my hand behind your back. And it's at about the 11th and 12th ribs. Fingers pointing to the axilla. Okay, we're just inside the rib margin. I'm having a real difficult time since she is so ticklish. But we want to push deep underneath that left rib cage. Ask her to take a deep breath. And we really take a deep breath for me. Okay, nice and firm. We're going to palpate the kidneys. Making sure my thing's still running. So again, I'm going to be on this side. I'm going to be feeling, okay? Okay, one hand behind the back, one hand on top. I'm not feeling anything just because she is so ticklish. Okay, I want to do the abdominal reflex. I take my hand at a 90-degree angle on the abdomen. And I'm going to release quickly, okay? Tell me if this hurts. Okay, little Miss Washboard belly. And the costovertebral angle, I said earlier, there's no pain or tenderness anywhere in there. Okay, Christina.